Hello humans, I'm Maddie Smith. Welcome back to my bed as I have called off from work yet again. In this episode, I'm going to do something I usually don't like to talk about. I'm going to list everything that is wrong with this body. That is, everything that is wrong with this body that can be connected to hypermobile Ehlers-Danlos Syndrome, or hEDS. Welcome to In Bed with hEDS. I don't like talking about this because it's personal, and frankly, I don't like people knowing what I'm dealing with because I don't want to be seen as weak or frail, but in certain ways I am, and I don't like admitting it. Also, there's people with the same disorder that have more going on than I do, but I think people need to know what hEDS is so that they can understand this disability. Therefore, I have gone over my medical records. I've read through the literature on hEDS, and I'm just going to list everything that I've been treated for that shows up in that literature. No explanations, just a list. Now, there is a caveat. I can't say that everything that I'm going to list is directly caused by hEDS. That's not how genetic disorders work. All I can say is that there was a greater chance of these things going wrong with me because of hEDS. When I say list, I mean list. I have bullet points in front of me, and I'm just going to read off everything I've been diagnosed with and give you a very brief description of the more exotic diagnoses, like clinodactyly, the bending or twisting of fingers or toes, like my big toes, which bend end and up, and my index fingers, which bend to the middle, toward the middle finger and twist kind of downward. Pes cavus, or as an ex-girlfriend who happens to be a doctor of physical therapy called it, ridiculously high arches in my feet. Recurring plantar fasciitis, which is the inflammation of the connective tissue in the bottom of the feet. I have pysogenic papules, which is lumps of fat pushing through the weakened tissues of my heels whenever I stand up. Weak ankles that easily roll and get twisted, making walking hard. I once rolled my ankle by stepping on a pebble, just a little pebble, Supination, or outward turning of my feet, for which I use ankle braces to correct. I have unstable knees, loud, unstable knees. They pop and crack all day long, and there's a lot that happens with my knees. I can strain the IT band on my left leg, which sometimes makes that knee click with every step. That's a tendon that runs along the outside of the leg and over the knee, so it gets in the way, and it clicks. Collapsing knees. Around age 11, they started going out occasionally. They buckle. I'll be walking along and one knee or the other will just stop working. I put my weight on it, it collapses, and I stumble and I catch myself with the other knee or other leg. It happens more and more often. I have had both ACL and MCL strains, and my knees hyperextend 20 degrees, which means my knees allow my thighs to bend over my shins 20 degrees more than typical people's, and that was not 20 degrees. I also get nighttime leg cramps. Multiple times I've been woken up by painful cramps. My legs just start, pulling in one direction or other. I have myalgia, which is muscle pain in random spots throughout my body. I have unstable hips. Occasionally I have to wear a trochanteric brace to walk comfortably. If I sit too long, my hips get so stiff that I limp whenever I get up. I have right leg's subluxation at the hip. That means it hasn't dislocated, but it has come partway out, and instead of swinging, it slips back and forth. Swinging, it slips back and forth. It doesn't happen all the time, but it happens occasionally. I have dislocated my sacrum multiple times. The bone that connects the pelvis to the spine twists out of place and is very painful and hard to walk when your upper body and lower body are facing two different directions, even if it is just a couple of degrees off. That was the first majorly disabling effect I had with when my symptoms started to get worse about 10 years ago. Come to think of it, it was that ex-girlfriend helped me figure out what was going on with me then. I have osteoarthritis in my lumbar spine and in my SI joints where the sacrum and the two ilia come together. Snapping scapula syndrome, which is one or both scapulae rub across the ribs in your back, causing a snapping sound. It's kind of like a snapping xylophone. Left shoulder subluxation. It comes partway out of socket for no apparent reason at all. Once I was standing at Target looking at pots and pans, and my shoulders fell out of place. Looking, not holding, looking. Flop. That happens so often it doesn't even hurt anymore. I have thoracic outlet syndrome. That means the blood vessels or nerves that pass through the thoracic outlet get pinched off when I hold my arm up and my hand starts to turn blue, especially on the right arm. I have left elbow hyperextension. I've had to use my right hand to pull it back into place occasionally. Epicondylitis, both medial and lateral, in both elbows, otherwise known as golfer's elbow and tennis elbow. And I neither golf nor play tennis. My right wrist was rebuilt after a bicycle accident because my ligaments weren't strong enough to handle the fall. I have dislocated both thumbs, not at the same time, thankfully, by holding books. Seriously, I was putting a book on a shelf and my thumb popped out of place at the CMC joint, right down here, both hands. I work at a library. I have arthralgia, pain and inflammation of the joints in all 10 fingers, but not necessarily arthritis. Interesting. My TMJ dislocates whenever I open my mouth too wide. So hamburgers can be an adventure. I have crowded crooked teeth, a high arched palate, and a deviated septum, or had one at least. I had surgery for it about a year ago. I have epicanthic folds. A white person with epicanthic folds. It's little folds in the corner of your eyes. It's a thing that HEDS does. I have mildly hyperextensible skin. So I can pull the skin out on my neck, or I can pull the skin on the back of my hand and it doesn't go down back as much and I have to smooth it out. No, I'm not going to do it. And I can bruise easily. That's another thing. I have atrophic scars, which that's scars that are below the level of the surrounding skin. A weak neck, so weak that I can't do sit-ups very long without supporting it with my hands. This is something else that ex-girlfriend pointed out. I think I owe her a lot for helping me get this diagnosis. Don't tell her that. Don't. I get migraines, cluster headaches, and occipital neuralgia, which is when the occipital nerve gets pinched in the neck and causes a headache that starts as a sharp pain and becomes a throb up the back of the head and around the side, kind of up in here. I also get trigeminal neuralgia, which is the same thing, and pinching, but affecting the trigeminal nerve, so I get facial pain and tics. My eye will start twitching like that, or it looks weirder when it's doing it on its own. Then there's craniocervical syndrome, which is where the bones of the neck slide around, pinching nerves, blood vessels, and causing pain and numbness in my arms and hands, and all those headaches I just mentioned, especially the neuralgias, the occipital and trigeminal. I have sleep apnea. I have tinnitus, or constant ringing in the ears, probably caused by craniocervical syndrome. Small fiber neuralgia in the second toe of my right foot, which is when a small nerve starts to die and sends electric shocks up my leg whenever I take a step. I have dysautonomia, which means my autonomic nervous system doesn't work correctly. So I get POTS, POTS, or positional orthostatic tachycardic syndrome, which is that dizzy feeling you get when you stand up too quickly, but it happens to me all the time, and I don't even have to get up quickly, it just does it. Dysautonomia also gives me cold intolerance, which means I start feeling cold in the 70s and my body temperature can change rapidly. I get Raynaud's sign, which means my fingers turn white, wrinkly, and painful whenever I get cold. I can be wearing thick gloves and I'm still going to get Raynaud's, pain in my hands. I also have ADHD, which for some reason that no one can explain is more common in people with hEDS. Then there's poor proprioception. That is the ability to tell which direction your joints are pointing. My proprioception is off, so I'm a klutz, and that's why I suck at sports, or why I can trip just walking down a hallway, not on anything, I just trip. I've lost my tonsils, gallbladder, and appendix in ways often seen in hEDS patients. I also have laryngopharyngeal reflux, or LPR, aka silent reflux, which is when stomach acid backs up and inflames the tissue while you're sleeping. The tissue in the throat, especially, without causing heartburn or other symptoms you get with GERD. That's why my voice gets hoarse or sometimes goes out altogether. Recurring constipation, sorry to mention it. Possibly a mild case of gastroparesis or slow emptying stomach. I have to get tested for that. I have chronic fatigue, not chronic fatigue syndrome. That's what they call it when they can't find a cause, but chronic fatigue due to a known disorder, hEDS. I have sleep disruptions. Sometimes I can't stay awake, and other times I can't sleep for like 2 or 3 days, which makes the fatigue a whole lot worse. And that's it. That's all the physical symptoms. And it has taken me over 6 minutes just to get through that list of my diagnosed effects of hEDS. In the last year and a half, I've been diagnosed with 39 different issues, and I don't have all the possible effects of hEDS. Another kind of effect of this disability are financial issues caused by paying for the treatments for all these things. Even with insurance, I got behind on my bills, overdrew my checking for the first time in 25 or 30 years, and then ended up eating ramen every night to save money. It's not so much, there's only so much you can do with ramen, I'm just saying. As I said before, I have a mild presentation of hEDS. There are people with way worse presentations of these genes. They may have different symptoms or the same symptoms I have, but they're stronger, they're more debilitating. My kid is one of them. They have several issues that I talked about here, but their presentations are all stronger than mine. They're only 18 and have a wheelchair. They can walk, but the fatigue they experience is so strong, but by the end of each day, they don't have the energy to do so. And the wheelchair isn't your like $150 from Amazon kind. No, they had to get a custom wheelchair that wouldn't dislocate their SI joints when they're sitting in it for a while. It was considerably more expensive, like over $1,000 expensive. Which brings me to the last effect of hEDS I have: guilt. Seeing your kids struggle with issues that your bad genes, my bad genes, have caused them is harrowing. Arduous, heart-wrenching. That's why I'm making these videos, to help people understand what hEDS is and to understand the effects that go beyond the physical and into the emotional and financial. In future episodes, I'll dive a lot deeper into these issues, and in the meantime, I hope you will consider this. Thanks for watching my channel. Please click like, share, and subscribe, and check out my other titles. Have a question for any show? Send it to questions@addisonsagenda.com. On my website, addisonsagenda.com, you can learn about booking me to speak at your event and much more. All money made from speaking, videos, or through a GoFundMe goes to help with the medical bills my kid and I have due to hypermobile Ehlers-Danlos Syndrome. The link to the GoFundMe is below, as is a link to the Ehlers-Danlos Society, where you can learn more about EDS. Thanks again for watching. Peace and long life.